All right, so the last part of this hip technique release, we're going to look at the internal rotation of the hip. So something that tends to get missed a lot as well. Now, this is the interesting and the most individual part of this technique release because it differs in every person that comes in the door, especially in terms of where they feel the restriction. So quite simply, 90 degrees hip flexion, 90 degrees knee flexion, okay? Support obviously at the heel here, support at the knee as well, and then just taking the hip into internal rotation. So obviously the hip joint's going in, not out. So don't get confused by what's happening here with the foot. So what we're looking for here is wherever the athlete will feel the restriction. So this is where it varies, okay? So sometimes it can be TFL, which is probably the most common. Other times it might be that hip flexor or even the rec fem. Sometimes it may even be the adductors, whether it be longus or magnus, and believe it or not, sometimes it could also be deep buttock, which is the deep external rotators. So I would say 90% of the time, I tend to find my athletes still get quite restricted at that TFL level. So I'll show you the release technique that I do for that. Tess has got really good range here. What we're looking for as we go through here is if there's any, it feels like if there's any sort of soft restrictions before you get to the end of the range. And that's what we're looking for. This is not pain, this is more about restriction. Okay, so if we're going to do the TFL, I'll just basically have the legs still in a bit of flexion, both knee and hip. I'm going to drop the table down a little bit because I need to get a little bit of purchase on here. And then I'm going to bring the knee across, which will inevitably give me really great access to the TFL, which is right there. And Tessa's got a ripping TFL, being a 400-metre runner. She spent a lot of time and effort in trying to get that. Okay, so once again, a little bit of pre-max. Okay, perfect for these release techniques. Once again, remember, as I said before with these release techniques, it's really all about just engaging the tissue the right way. Okay, so don't try and rush through these techniques. Take your time, make sure you feel the tissue release, and it just makes all the difference. So I'm going to come up a little bit high here, just pick up some of the fascia here just from that ITB, not into the ITB because I'm not a massive fan of massaging ITB unless you just like creating pain. So once again, a loose fist, okay? And what I'm going to do is just engage the tissue, okay? So taking that skin laxity out, and then we just slowly start to work through that. Now what we do at the same time, bring the hip over into a little bit of hip adduction. That's adduction, A-double-D, not A-B-D. And just work through that range. Now, inevitably, once we get up to the top of the TFL, that's where the most sensitive portion is, because that's where that trigger point lies. Okay, so we can get up to the top there, and then we can just sit nicely onto that trigger point there. Can you feel that, Tess? Yep, you can. Normally tell with Tess because she'll start to grin. Okay, so we just sit on there, make sure it's tolerably comfortable. It's not too much. It means she's not guarding, she's not fighting against us. All you experienced therapists will know all about this, 101. Make it therapeutic. Not every technique you do has to absolutely obliterate your clients. Okay, so once again, I'm just feeling that releasing through there. That's just great. Okay, now for some of you that want to try and save your fists, we can do a second approach to this, which is really quite easy. We just bring the table up a little bit more. And once again, because I'm a big fan of saving your hands as well, so I may want to use just a broad forearm again, so we can just come in this way here and work down the tissue as well. So it's just as effective, it's just a little bit more broad. You're still covering the same sort of tissue. You can still engage the trigger point at the end. You'll still get the same result, just means you're using a different tool. So, and that obviously can make a big difference depending on the size of the athlete you're working on. So, yeah. So a simple approach, and then obviously we take them back up into internal rotation and recheck. Well, that's pretty good, Tess. Straight away you'll start to feel there'll be a change in their range of movement, both the quality but also the amount of it as well. Now if they feel a secondary restriction, then we go there, do a similar process. Simple.